a growing concern for women with pregnancy complications. A study found they could be at risk for heart problems even decades after giving birth. Thank you for staying with us. I'm Erin LeBeau.
And I'm Shirley Chan in for Tamsin today. Well, this study involved more than 2 million women over a span of 45 years. The risk factor for ischemic heart disease in particular was sometimes double for women with different pregnancy complications. Now, this is a reminder of that difficult pregnancies. They need to be part of a woman's medical history even years after delivery.
Yeah, so joining us now to talk about it is Dr. Dina Adimulan, assistant professor at Mount Sinai. Thank you for joining us.
Thank you so much for having me.
All right, doctor, can you jump right in and explain what ischemic heart disease is?
Sure. So when we talk about ischemic heart disease, it's first important to understand what is ischemia. So ischemia is basically decreased blood flow to any of our vital organs that leads to a decrease in oxygen supply. In this case, when we talk about cardiac ischemic disease, we're talking about a decreased blood flow, decreased oxygenation to the heart, which doesn't allow the heart to function properly. This is usually due to some narrowing of the arteries or the main blood supply that provides the heart with oxygen. And once those arteries get blocked with something called plaque, there's a decrease in blood flow leading to damage to the heart tissue.
All right. Now, what type of pregnancy complications were taken into account for the study, and why is the risk different for some of them?
So there's many different pregnancy complications that were noted in this study, and there's many others beyond what we're talking about here. So some of those pregnancy outcomes include small for gestational age. What that means is delivering a baby that is smaller than 10% of the weight that would be expected for a baby of the same age, as well as preterm labor, which means delivering a baby before 37 weeks, having something called preeclampsia, which is identified by having high blood pressure, having protein in the urine, which is suggestive that the pregnancy is leading to complications not just on the heart, but also on the kidney, as well as swelling of the hands and legs. There's also this larger term called hypertensive complications of pregnancy, and that's referring to people that have had high blood pressure before pregnancy and continue to have high blood pressure during their pregnancy, as well as gestational hypertension, which is pregnancy that's defined after 20 weeks of pregnancy.
So, doctor,
blood pressure 20
in this study, as the women got older, was there a greater chance of them having heart disease?
So looking at the study, it suggests that that's possible, but this study is actually looking at 2 million women, and the average age is actually in the mid-20s. So we haven't really looked at the data looking at older women, but that's a really important point to bring up because as we know here in the United States, women are getting pregnant later and later. And as a result, we know that there can be increased complications from pregnancy as well as increased risk of disease related to age in general.
All right, now, Dr. Dina, if a woman has pregnancy complications, is there a way that she can lower her heart disease risk?
Absolutely. So we talk about changing different risk factors related to preventing heart disease, and it goes not just for regular heart disease, but also for ischemic heart disease. And when we talk about those risk factors, we want to talk about lifestyle, right? So we want to make sure that people are getting in their routine amount of exercise. We typically recommend 120 minutes of moderate activity every single week to help with prevent cardiac disease. We also like to look at nutrition, which is very important. So making sure we're getting in our fruits, our vegetables, as well as avoiding things that are highly processed, have a lot of added ingredients and excess sugars. We like to also concentrate on sleep. That's something that we often forget about, but sleep is so important. We know that people that don't sleep enough hours of the day have an increased risk of heart disease. So focusing in on getting in more sleep, focusing in on why you're not sleeping enough and talking to your doctor about that is extremely important. And stress reduction. Stress has a huge impact on our body, especially on our heart. So it is very important to think about ways of decreasing stress. That might mean exercising more. It might mean doing more mindfulness, more gratitude, more positivity in your day. Anything that helps you decrease that stress level can be ultimately helpful. And once you have this diagnosis of a pregnancy complication, it's important to talk to your doctor about decreasing your risk factor of having high blood pressure. So you want to be monitoring your blood pressure throughout the rest of your life, making sure you're screened for things like diabetes, as well as high cholesterol, which can easily be screened for with a blood test.
All right. Well, Dr. Dina, thank you so much for joining us today and shedding light on this issue.
Thank you so much for having me.